You wake up in the morning. Before you even check the time, before you reach for your phone, before you think about what the day holds, you notice your legs. Maybe they feel heavy. Not painful exactly, just weighted, like they belong to someone older than you feel inside. Maybe there is a dull aching that was not there when you went to sleep. Maybe your ankles look slightly fuller than they did yesterday. Maybe you swing your legs over the side of the bed and there is a stiffness, a reluctance in the tissue that takes 10 or 15 minutes to ease off before you feel like yourself again. You have probably told yourself it is nothing. Old age, sleeping in the wrong position, not enough movement yesterday. I need you to consider something else today, because in my years of practice working with patients over 60, I have learned that the legs are one of the most reliable communication systems the human body has. And what they are communicating in the morning, specifically in the morning, is not always a message about your legs at all. Sometimes it is a message about your heart. Not a dramatic message, not a heart attack warning, but a quiet, consistent, early signal that the cardiovascular system is working under pressure it was not designed to carry indefinitely. The kind of signal that, if you understand it, gives you time to act. The kind of signal that, if you dismiss it, tends to announce itself much more loudly somewhere down the road. Today, I am going to walk you through exactly what your legs may be telling you, why the heart is involved, what the underlying mechanisms are, and, most importantly, how to tell the difference between what is genuinely concerning and what is not. Of course, no video can determine the cause of symptoms in an individual person. The goal today is to help you understand what may deserve attention and when it may be worth discussing with your doctor. Stay with me through this entire video, because the connection I am going to explain in the middle of this video is the one that most people, including many who have been to their doctor about this, have never had properly explained to them. Let me tell you the 4 morning leg signals that make me pay attention as a physician, because if you experience one of these occasionally, it may mean very little. But if you experience them repeatedly, they deserve a closer look. The first is heaviness, not pain, not weakness. Just a strange sense that your legs feel heavier when you first get out of bed than they should. The second is ankle fullness. You look down in the morning and your socks leave deeper marks than they used to. Your ankles look slightly puffier than they looked a year ago. The third is a tight, aching sensation in the calves that improves after you have been moving around for 15 or 20 minutes. And the fourth is the one that concerns me most. You stand up. You begin walking. And within a short distance, your legs feel tired, cramped, or reluctant to keep going. Then something interesting happens. You stop. You rest. And the discomfort eases. If that pattern sounds familiar, I want you to stay with me. Because here is what surprises most people. Many of the patients who experience these symptoms have no chest pain, no dramatic shortness of breath, no obvious sign that anything is wrong with their heart. The warning shows up somewhere else first, in the legs. That is why physicians pay attention when a patient says their legs just do not feel right in the morning. Because what sounds like a leg complaint is often a circulation complaint. And what sounds like a circulation complaint is sometimes a heart complaint. The reason for that connection comes down to one simple fact about how your cardiovascular system is designed. A few years ago, a man in his early 70s came into my office and described exactly what we are talking about. He did not complain about chest pain. He was not worried about his heart. His concern was that his legs felt strangely heavy every morning. Not enough to stop him from living his life. Not enough to feel like an emergency. Just enough that he knew something had changed. For almost 2 years, he had assumed it was simply part of getting older. When we looked more closely, however, we found early signs that his cardiovascular system was under strain. Nothing catastrophic. Nothing that required panic. But something that absolutely benefited from being identified when it was. His story illustrates the core principle behind everything I am about to explain. The heart can only function properly if blood not only flows out to the body, but also returns efficiently. And that return journey is actually the harder part. Blood from your feet and legs must travel upward against gravity to get back to the heart. When that return system becomes less efficient, the effects often appear in the legs first. Not in the chest, not in the heart, in the legs. That is why doctors pay attention when morning leg symptoms become persistent. They are often the first visible clue that something deeper may be developing. And here is something even more important. The fact that these symptoms appear specifically in the morning is not random. In medicine, timing tells us as much as the symptom itself. How your legs feel when you first wake up often reveals problems that are much easier to miss once you have been moving around for a few hours. The morning timing is one of the biggest clues in this entire picture. But not all morning leg symptoms mean the same thing. Each of the 4 patterns I described a moment ago points toward a different mechanism in the cardiovascular system. Let me walk through each one, because understanding which pattern matches what you are experiencing is what turns a vague worry into a specific, actionable conversation with your doctor. The first mechanism is venous insufficiency. The one-way valves inside the leg veins weaken with age. When those valves no longer close properly, blood that should be moving upward toward the heart pulls backward into the lower leg. This is common after 60, and it is strongly associated with high blood pressure over time, because sustained high pressure damages vein walls and valve integrity progressively. The second is right-sided cardiac strain. The right side of the heart is responsible for receiving blood returning from the body and pumping it into the lungs. When the right side of the heart is under pressure, from lung conditions, from long-term high blood pressure, from certain heart rhythm problems, it cannot receive and process returning blood efficiently. Fluid backs up in the venous system. The legs and ankles are where it collects. The third is early heart failure. I want to be precise about this term because it frightens people unnecessarily. Heart failure does not mean the heart has stopped or is about to stop. It means the heart muscle is not pumping with its full designed efficiency. In the early stages, the primary symptom is often nothing more than what I have described. Legs that feel heavy in the morning, ankles that swell during the day, a fatigue that is slightly deeper than normal tiredness. These are the warning signs that, caught at this stage, allow for interventions that can preserve cardiac function for years or decades. One patient I remember particularly well almost did not come in at all. She told herself for months that she was simply getting older. Her ankles were swelling slightly by evening. Her legs felt unusually heavy in the morning, and she found herself needing more rest than she used to. None of those symptoms felt dramatic. In fact, that was exactly the problem. When we eventually evaluated her heart function, we found early-stage heart failure. The encouraging part is that we found it early. Treatment began before significant damage occurred. Years later, she was still active, independent, and doing well. The outcome was good because the warning signs were heard early instead of ignored. Not every morning leg symptom, however, is caused by fluid accumulation. Some are caused by the opposite problem. Not too much blood pooling in the legs, but too little blood reaching them in the first place. The fourth mechanism is arterial insufficiency, reduced blood flow into the legs from narrowed arteries. Legs that feel cold, numb, or cramping when you first get up and begin moving can indicate that the arteries supplying the leg muscles have become narrowed, often from the same process that affects the coronary arteries of the heart. When a patient tells me their legs cramp within a few minutes of walking, and the cramp eases when they stop, that symptom has a clinical name: intermittent claudication, and it is a cardiovascular signal that needs investigation. And then there is another group of patients I see frequently, the ones who tell me their heart has already been checked. One gentleman told me exactly that. His blood pressure was acceptable. His routine tests looked normal, and yet the heaviness in his legs continued. When additional testing was performed, we discovered a circulation problem that standard screening had not revealed. Nothing life-threatening, but something important that would have remained hidden if he had accepted the first reassurance as the final answer. That experience points to something worth understanding clearly. A standard appointment for leg heaviness typically involves a blood pressure check, a listen to the heart, and sometimes a blood test. What it rarely involves is an echocardiogram, an ultrasound of the heart muscle itself, or a detailed venous duplex scan of the leg veins. In some situations, those investigations reveal information that routine screening does not capture, which is why doctors sometimes order them when symptoms persist. The cardiovascular system can be functioning below its optimal capacity for years, producing exactly the morning symptoms you are experiencing, while every routine test comes back within normal range. Normal routine tests are reassuring, but they do not always answer every clinical question. This is not a failure of your doctor. It is a limitation of standard screening that your doctor would agree with if there were time to discuss it properly. The question is how to use this information constructively rather than anxiously. None of these symptoms by themselves can diagnose a heart or circulation problem. What they can do is help identify situations where a more detailed medical evaluation may be worthwhile. Here is the framework I want you to carry, not to frighten you, but to give you clarity about when morning leg symptoms warrant a direct conversation with your physician. The symptoms that are lower concern on their own: leg heaviness that resolves completely within 15 to 20 minutes of being upright and moving, mild ankle puffiness at the end of a long day that is gone by morning, occasional morning stiffness that responds well to gentle movement and warmth. the symptoms that warrant a direct conversation with your doctor. Ankle swelling that is still visible when you wake up in the morning, meaning the overnight horizontal period did not clear it. Leg heaviness that is getting progressively worse week over week rather than staying stable. One leg swelling significantly more than the other. This asymmetry is clinically important and should never be ignored. Leg symptoms accompanied by any shortness of breath, particularly when lying flat or climbing stairs. Leg cramping that comes on with a consistent and short amount of walking and reliably eases with rest. A new feeling of fatigue that is deeper than your normal tiredness and has no obvious explanation. Any combination of two or more of those symptoms together is a reason to book an appointment and specifically ask for a cardiac and vascular assessment, not just a routine blood pressure check. Now let me give you something practical, because knowing a warning sign matters far less than knowing what to do with that knowledge. The first and most impactful thing you can do for venous return and cardiovascular leg health is also the simplest. Move your legs deliberately within the first 10 minutes of waking up. Before you stand, pump your ankles up and down while still in bed, 10 repetitions. Rotate each foot 10 times in each direction. This activates the calf muscle pump, the muscular mechanism that physically squeezes blood upward through the leg veins, before gravity has a chance to begin pooling fluid downward. It costs nothing. It takes 2 minutes, and it makes a measurable difference to how your legs feel for the first hour of the day. The second practical action is fluid and sodium awareness. Excess sodium causes the body to retain water in tissue. That retained water is pulled downward by gravity and accumulates preferentially in the lower legs, reducing processed food sodium. Not eliminating salt entirely, but being conscious of the hidden sodium in packaged foods, bread, and ready meals. Reduces the volume of fluid available to accumulate in the first place. The third action is elevation during rest periods. When you sit for extended periods during the day, raising your feet to hip height or above allows gravity to assist venous return rather than oppose it. A footstool, a pillow under the ankles, a reclining position. Any of these for 20 to 30 minutes in the afternoon changes the fluid dynamic in the lower legs measurably by evening. The fourth and most important action is the conversation with your doctor. Symptoms need to be interpreted in the context of your medical history, your medications, your examination findings, and any testing that may be appropriate for your situation. Not a passive mention at the end of an appointment about something else. A specific, direct request. Tell your doctor, I have been experiencing morning leg heaviness that I want to understand properly. I would like to know whether a cardiac assessment and a venous assessment are appropriate given my age and these symptoms. That sentence moves the clinical conversation from routine to investigative. It is the sentence that gets you the tests that matter. Here's what I want you to carry from this video. Your legs and your heart are not separate systems. They are part of one continuous circuit, and that circuit communicates its status through the symptoms you experience at the furthest points from center. The heaviness you feel in the morning is that communication. It deserves to be heard. The majority of people who experience what I have described today do not have a serious cardiac event in their future. What they have is a body that is asking for attention, for a change in movement habits, for a conversation with their doctor, for a slightly closer look at a system that has been working without maintenance for 60 plus years. The patients I worry about are not the ones who come to me with morning leg heaviness. The patients I worry about are the ones who had it for 3 years, told themselves it was nothing, and arrived in my consulting room only after something more serious had already developed. You are not going to be one of those patients, because you now know what to listen for, and you know what to do with what you hear. If someone in your life, a partner, a sibling, a friend, has been mentioning heavy legs or swollen ankles and brushing it off, send them this video. The information that reaches them today may be the reason they book an appointment tomorrow.